Hi, I'm Dr. Rahul Bagrecha, MDS Oral and Maxillofacial Surgeon, a university certified implantologist from Teeth and Faces Dental Clinic and Implant Center. Today we are going to discuss about dental implant. What is dental implant? Dental implant is a modern surgical tool which is used to replace a missing teeth. Dental implant is a cylinder-like structure. It is made up of titanium. Most commonly, it is made up of titanium. It has threads onto that, and the threads do have a micro porosities or micro irregularities on top of it. Dental implant is made up of two components mainly. One component which has a thread, which, as I told you about. This cylinder-like structure with a thread on top of it goes inside the bone. This is one part of a dental implant which replaces the root of your natural tooth. It is an exact replica of a root of a natural tooth. Second component which is fixed on top of this cylinder after 3 months most commonly when this cylinder is fused with your bone. The second component is used to fix the artificial tooth or a crown on top of this cylinder. Dental implant is most commonly made up of titanium, which is a bio-inert material. Sometimes it do have a positive effect onto bone, a native bone, which causes a, a positive deposition of a bone onto the surface. The micro irregularities and the threads on top of this cylinder are used for anchoring this cylinder actively into the bone, and the micro irregularities or micro porosities increases the surface area by which the bone which has been deposited onto the surface of this cylinder gets more surface area, so more anchorage and more fitting inside the bone. So the second component, which is called abutment, we come back after 3 months, and with the help of a screw, another screw, we fix this abutment with tooth attached onto this abutment into the cylinder body, which is hollow from inside. So the dental implant is most natural replica, as close as possible to the natural tooth as possible. How? So natural tooth has a crown part, the tooth part which is visible into the oral cavity. This is called crown. The second part, which is inside the bone, where this tooth has been anchored inside the bone, is called the root part. Dental implant, on the other hand, has the same thing. A crown part, the artificial tooth now, which is replacing the crown part, the tooth which was there in your mouth. And second, the root part, which is the cylinder with the thread which has gone inside the bone, it replaces the natural tooth root. The forces distributed into the tooth are from crown part, the tooth part, that the forces are biting forces. They are transferred from this tooth part, the crown part, through the root into the bone. Same way in the implant. The forces of biting are transmitted through the crown part, the artificial tooth part, through the root, that is the thread, the cylinder around the threads, and this whole structure, which is now exact replica of your root. It transfers the forces from the tooth part through this cylinder, through these threads inside the bone.